All right, we're live. I'm Bryce Hancock. Uh, Welcome to Mile High Recovery Chat. I'm here with Andrew Wainwright,
Hi,
founder of
Bryce.
AiR Health in St. Paul, Minnesota. We went to college together. One of my best friends for the last over 30 years. I got to stop saying that. So we're just gonna get right into it. So I've been kind of doing like this. Like clickbait, right? Like the best way to get and keep somebody sober. And I don't know what the best way is. I don't, but I want people to tune in because I believe what you have to say is important. And I believe this discussion is important. So in 2015, you turned me on to sober housing. You introduced me to Chris Edrington, and I learned, I think, from the best. I think it's the best like person to teach me sober living is Chris Edrington. I don't know anyone that knows as much about it as he does, except maybe like the founder of Oxford House. I don't know. But I think it's a good program. I think the way he does it is it's good. I think it is just as good as like, a lot of treatment centers. And so we did a documentary and right. And I knew what I knew. What I really knew was that I had gotten sober against all odds. But what I didn't realize is that what happened to me was like there was this internal shift. And I really wanted to be sober and I got it. And unfortunately, it's really hard to recreate that internal shift for people. Right. And so we did the documentary and you spoke in a way that lays it out for me, like really laid it out for me. And it kind of changed the way I thought about recovery and treatment, the behavioral health care system, the way I would fit in it, and like the way I've kind of run my whole career. And so talk about, because you started interventions, didn't like all the families would contact you later, so-and-so's drinking or on drugs again. And then you moved into case management and aftercare. And you sometimes talk about the pilots program.
Yeah, happy to. I was talking to your friend Craig Lesueur. I think you're gonna have one in a couple of weeks earlier today, and we were talking about the same stuff, right? This is the cutting edge stuff. Chronic care management for substance use disorder, and it's not just enough to talk about it. We've been talking about it for 40 years. The question now is, what are we going to do about it, right? Like, there's enough living in the past. And identifying the problem. Like, it's not enough to say, oh, there's a fire over there. Like, somebody's got to go over there and put it out, right? Like, someone needs to take action. And so we were talking about that today, and what he said was in this context, he said, integrity is the long game. And I think what he means by that is that there have to be some ethics and some integrity when we're talking about the provision of care for folks with SUD over a long period of time. And when you're talking about the pilots program, so this goes back to, I was doing intervention work and we were caring for folks and answering the phone when families called. And we felt good about it, right? Because I had a mother that struggled trying to figure out how to help her son 25 years ago, right? And I know lots of people that were in the same position, and help's not readily available. I think it might even be harder to find now that there's more of it on the World Wide Web. It might be more confusing than ever to find, good sources of real help. So we felt good about taking phone calls, and we felt good about helping families. I didn't feel good, like we talked about last week, about talking to, Bryce's mom 6 months later when Bryce is drinking again after he'd already been to treatment. So that's when we moved into, long-term care management. And one of the ways that I found my way there, the part of my education has been finding smart people, by happenstance or, by hard work and learning from them. And I think, you've done, effectively the same thing. So I went up to Hazelden, which at the time, and I think today is still, the world's leading and largest drug and alcohol treatment facility. And I talked to them about this concept. And they, at the time, provisioned what was called the pilots program for the then Exton airline, Northwest Airlines, which got bought by Delta. But the hub was here in the Twin Cities. So if I was the pilot on a Northwest airline flight and you were my co-pilot, and, of a morning we're about to take off and my breath smells like vodka and you say something, we would step off the plane and they would call management and someone would come right to the gate and intervene, right? Intercede. They would find you another pilot and they would take me up to Hazelden for an assessment. So that was the plan. And if I wanted to stay and be a pilot, they said, here's the hoops, right? There's X amount of hoops over Y amount of years. And it's a lot of hoops, and it was strict, and it lasted for 5 years. The good news was most of these guys said, I want to be a pilot. I don't want to walk away. You know, it was a grievous error. I got a family. I like flying. I'll do the work. Awesome. Here's the work. And the work was clearly outlined, and it lasted for 5 years. And there was meetings and drug testing and all kinds of stuff that you had to do. The really good news was at the 5-year mark, 92% of those that completed the program were in remission and had stayed in continuous remission from substance use disorder since the moment they entered the pilot's program. So it's amazing, right? 92% efficacy for any drug.
92%.
92%.
9 out of 10 pilots were still, essentially sober after 5 years.
No, not essentially. They were, right? It was studied and contracted and tested for continuously, week over week, for 5 years. And these guys were in continuous remission. So, but the regular Joe, Bryce or an Andrew, who would go up to Hazelden for 28 days and do our time and then get released, which was at the time the traditional model for inpatient residential treatment. And they would send us home with a continuing care plan saying, Bryce, when you get home, do these 10 things and you're going to be okay. The 1 year continuous remission rate for you or me getting out of the same treatment center, getting the same treatment the pilots did, was less than 25%. So I went up there and I asked him, and this was, 15 years ago. I was like, what's the deal? How come, the pilot over here is recovering at 92% and Bryce and I have less than a 25% chance of recovery? And there was a big story, right, about how pilots are pilots, and these guys are smarter than Bryce and Andrew, and they work harder, and they have more to lose, and you don't understand what it's like to fly jets, and these guys are motivated, and they're A students, and you guys are like C- students, and there wasn't much chance that the two of you were going to get sober anyway. And anyway, just there was lots of blah, blah, blah. And I'd already been working with families for a long time, and it just didn't pass the sniff test. I was like, I don't think so. I'm not buying it. It's just
nobody wants to show up in the world drunk all the time or standing in line at the methadone clinic.
No.
Right.
And pilots aren't the only ones with things to lose, right? You've got children, I've got children, and lots of alcoholics and addicts are willing to lose their children. That's true too. But everyone's motivated by different stuff. And this idea that you had to be a pilot to recover 92% was like, I was like, not a chance. I was like, there's multiple elements to that story. Hazelden hung their hat on the idea that they were pilots. The whole sentence there is they went to primary treatment. They did 5 years of intensive case management. So pilots went to treatment, did 5 years of case management. There's 3 key elements. The one they focus on is that they're pilots.
Right.
I was like, well, if Bryce and Andrew go to the same treatment, they're not pilots. The other third element, the random element that doesn't get focused on, is they were intensely care managed for a long period of time. And I just, call me crazy. I picked 1 out of 3. I'm not a mathematician, but I was like, I think that's the one that's salient here.
So you think therapy, UAs, meetings, and all that care is really the ticket?
I think it's so the chronic care model. Let's pretend you've got diabetes.
Okay.
You go to the hospital because you have a diabetic episode and you fall down. They take you to the emergency room. They diagnose you've got diabetes. And then they're going to probably keep you there for a couple of days and teach you what it means to be a diabetic, teach you how to manage your insulin. There's a lot of work to do in learning. And then because you've got, let's call it, you're with the blues for your carrier, there's coding set up and care management plans laid out for you to take care of you today, tomorrow, next month, next year, as long as you're with that carrier. If you switch carriers, it doesn't matter. CMS still provisions long-term care plans for the chronic disease of diabetes. They understand that you will never really get well, and it's relapsing and remitting like substance use disorder, and you're going to need to be cared for over time. And they are willing to pay for it. They believe that it's chronic, and they believe that caring for it over time is the best model to treat it. So that's not extant for substance use disorder, even though every similarity is there, right? It's a chronic illness in the same way. So there's no reinventing the wheel here. We're taking the same model, which is that ongoing assessment, ASAM criteria for substance use disorder, not just at the time that you enter treatment, but when you leave and continuously thereafter to manage and moderate the care plan as needed. Some days you need more insulin, some days you need less. You may need to switch types of medication. The same falls true for folks with substance use disorder. You don't just go to an acute care facility and have an acute episode of care, go home, and it's okay. You need continuous ongoing assessment with an independent third party to evaluate that assessment and tweak and manage your care plan. And it doesn't exist in our world of tools that are readily available, especially ones that are paid for by carriers. So in my case, this was back in the early 2000s, we built it, we took best practices from the pilots program and others, and we built our own because I didn't want to have to take that phone call from your mom. So when it came around this time, I would say to your mother, I'd say, listen, yes, we can do what you want to have happen, which is put Bryce in acute care treatment. We can rescue him and detox him and fix him. But if I want to really give you what you want, which is a happy, healthy kid 5 years down the road, we need to care manage him. And unfortunately for her, that was news, right? That was not a common practice at the time. It's still not a common practice. I was talking to a large employer yesterday about taking care of 50,000 employees. And I said, this is the model you need to use. I get that you have carriers and you like the carriers because they're coast to coast and they can take care of your whole population. But I believe that the model that they're putting into place today is outdated, and you're going to get the same sort of outcomes we've always gotten. And if you want to get different outcomes, then you got to do something differently. And I said something differently is chronic care management.
All right. So let me just sum up. So you were an interventionist, and mothers would say, my son Bryce is drinking, please get him to treatment. And you would take him to treatment, and then there would be a 75% chance in a year that I'd be drunk again. And my mom would call you, and you got tired of hearing that conversation. And you said, they don't really want me to take Bryce to treatment. They want me to get Bryce well. They want Bryce clean and sober and, living a happy life with a job and a wife and kids and whatever else it is. And the traditional treatment, 28-day treatment model wasn't really working. And so you created a longer term model kind of based on the pilots program.
Yeah, because, and this goes to, ethics, I think that business is business. I'm not condemning any part of the continuum. We live in a, free market capitalistic society, and it's a for-profit healthcare system that supports and manages how we get care. So everybody's entitled to do the best they can and build the pieces that support us today.
Right, and let me stop you. I don't want to bag on 28-day treatment. It's part of the continuum of care, as we call it, which is, is how we get well. That's the first 28 days. What you're talking about is what happens the day after you leave treatment.
Yeah, like the single most important statistic to measure efficacy or to find out whether Bryce is going to stay sober post-discharge is whether you make it to your first appointment 7 days out of treatment. So if you do, there's like a 90% chance you're going to stay sober. If you don't, there's like a 9% chance you won't. And it sounds crazy, but objects in motion tend to stay in motion, and care managers are really good at keeping objects in motion. So if I can keep you moving forward and make it to your first appointment and make it to your psych or make it to your outpatient or all the different pieces of the puzzle that I think would be useful for you, and then follow up, right? Because I'm not necessarily trusting you. I'm not necessarily believing that you're going, right? Hold you accountable, and then hold you accountable next week and again over time, because we're shooting for the 1 year mark. And it's not a magical, mythical, make-believe mark because it's the number one. It's the real amount of time that it takes the brain to reset and produce serotonin and certain chemicals that we need that we overrode during the time that we used drugs and drank, right? So we changed the way the brain functioned, and it really does take 12 months for it to reset. So this idea that you can go get detoxed in 24, 48 hours, 3 days and pop back out and be okay is nonsense. That's not how recovery for this illness works.
Because it's a chronic disease, just like diabetes. However, diabetes is treated in a certain way for a chronic disease. Substance use disorder is treated as what? An episodic?
Acute. Yep. So there's acute and chronic. So you go to the emergency department, they release you. You go to primary inpatient treatment, they're going to release you. They're going to send you home with a plan. But do I trust someone that was using drugs like Bryce Hancock was and then just slips away for 28 days to smoke cigarettes and drink coffee to execute really well on his own behalf, like 24 hours after he gets home? I do not. So I don't have any real faith that you're going to take that piece of paper and run home and be an A+ student and just get to work. That's not really what happens.
Okay. So in my, at my treatment center, we treat a lot of younger adults, I'd say early to mid 20s. Maybe you could call them failure to launch. They've graduated from college, probably. Kind of like yourself when you were a young man and 26 years old and you sort of crashed and burned out there in DC. That's my population. Our average client's been to treatment a minimum of 5 times. So I want you to take like a hypothetical failure to launch, young. You can take a young man if you want, who's never had a successful career, but has had some success in life and still has loved ones. Let's say I'm the parent. How do I get this guy sober? How do I get my young 23-year-old son sober for good, and so I don't have to keep sending him back to residential or whatever it is?
Yeah.
Okay.
So there's a kind of funny story that maybe is not so funny, but there's a big push many years ago that that we had to understand this was an illness, it was a disease, and that because you had a disease on some level you didn't have this accountability, right? So we would talk a lot about people being sick with this disease, and somehow that it lifted all of the pain and the shame and the guilt from the individual or his parents or whoever else was involved, right? No one's to blame. It's genetic that Bryce needs glasses, that he drinks, that whatever. But then at work, when we take all these phone calls, we had it wasn't actually written on the wall, but the unwritten sort of like writing on the wall was, it's always the parents' fault. And that's not to shame parents necessarily. It means that they don't have the teachings or the learnings or the education to do this the right way. And we wrote actually an entire book about this. And so it's called It's Not Okay to Be a Cannibal, which we wrote 15 years ago about interventions, was primarily about families' inability to effectively drive the change they want because nobody taught them how to do it. So, if you want to go, I know you like to go scuba diving. If you had never been trained to be a scuba diver, you have like zero chance of putting on the equipment and going under the water and surviving, right? So I feel the same way about parents when they've got these kinds of kids and they rely upon what they know is I'll send them to treatment and that supposedly is the magic elixir that'll make them well. But for parents who've tried that 5 times, obviously it's not, right? Now the average time is, 2 to 3 times in primary care treatment before folks get well. And I think that's a ridiculous number. You shouldn't have to have 2 or 3 knee surgeries before your knee's repaired, right? We're good at knees today. You go, you have the surgery and your knee is, much better. So we're so far behind with all this stuff, but it comes down to, I think parents come at all this from a place of love, right? They love their children and they want to put their arms around their kids and make them soup and get out the Bactine and, rub the boo-boos and fix it, right? They want to pay off the DUI and tell the lawyer to get my son off so that he doesn't have anything on his record. And they just want to make it better. And that makes perfect sense, linear, logical sense from a parent's perspective. And the perverse nature of treatment for, this piece of the puzzle is that we would ask parents to do the inverse of what they're comfortable doing, right? And it doesn't mean we're not going to ask you to love your kids, but, it's this concept of tough love that's been around for a long time. And there are ways to be transparent about how you feel about your kid and love them. And at the same time, hold them very clearly accountable to behaviors and actions and not support those actions. So we talk about this a lot. There's a limited, very small amount of the population that actually is okay with going down and living under the bridge, right? And they're going to make a fire with Sterno and they're going to drink Listerine, and that's a high quality life, and that's what they want to do. Every parent, however, believes that when their child is acting out this way, that if they don't do what they're doing, that their kid will do that, say, I hate you, I don't love you, I'm going to go run away, and they're going to end up there. This is somehow this mythological, terrible place. But the reality is that's a fantasy, right? There's a small portion of people that, so I'm in Minnesota, and when I have young 16-year-old Bryce Hancock, and I tell him, listen, this is where we have choices to make, and it's snowing outside, that's a good thing for me, because I don't really think you're that tough of a guy, even with your down coat on. You're not going to last a long time out there. And once we start, this is basic intervention 101, limiting your ability to conduct your life or your life the way your disease would like it to be conducted, then we can really go to war against your disease, which is a longer, deeper conversation. But I want your disease to lose and I want Bryce back. And there's a lot of steps we take to do that. So, with this family we're talking about, it's about re-education for the families. I think the quicker we can get that person off the street, and then the quicker we can do something different, the quicker we're going to get a different result. There's no logical reason anybody should have to go to 5 treatments. It may be 5 detoxes because folks may be so sick that they need to be medically detoxed from whatever they're back on. But at some point, we need a new strategy. We need a new plan. And I think long-term care management and tight accountability, sober living, right? Long-term sober living, all of those things are the keys to long-term success. I would tell you, and I've told, folks from coast to coast, the single best dollar to spend in the healthcare economy for substance use disorder is sober living. In terms of value, return on investment, sober living is absolutely, without a doubt, where I'd throw my money, right? It's not in another long extended, inpatient residential. Because once you have, you've had the education, you took the test, right? Now it's time to do the next thing.
Right. And I get it. Like especially for your first time, like at a real attempt at getting clean or putting the disease in remission, 28 days of treatment is like great, right? You're going to get detoxed, assessed, stabilized. If you can't physically stop picking up and stop drinking, 28 days away is a great kind of a way to reset. But for a young person who's been 4 or 5 times, it might be a waste at that point. It's kind of what you're saying.
I think it's an absolute waste. I mean, Alcoholics Anonymous has been around since 1936, right? It's the single greatest treatment modality we have for this illness. At any point, anybody, here's the deal. Going to residential treatment is a luxury, right? Whether you have insurance or not, it's a tremendous gift and an opportunity. And the opportunity also exists to, go down to the payphone at the corner, make a phone call and find your local AA meeting and stumble in there, drunk or sober. And, thousands of people get sober every month in exactly that model. So, if we're talking about this mythical kid who's been to treatment 5 times, we've got to do something different. And, here's the thing. I love Alcoholics Anonymous. I love the Salvation Army. I love, entitled folks that have done it. They've been to treatment 5 times. They expect mom and dad to bail them out and please drop my car off and pay for first month's rent. And it's like, absolutely, we're not doing any of that anymore. If you want to be a big time drug addict, right? You want to be that guy. You're going to drink like, a real alcoholic, and you want to be that guy, go for it, right? I challenge you to go out and make a real living of it the way that those guys do, because that's not a life that anybody wants. And so once you're really faced with subsidizing, your own lifestyle, that's a different kettle of fish. Right.
All right. So we got 5 minutes, and the next time we can really get into like a good treatment plan. But so if a family has insurance and you can utilize, the insurance benefits, you can do detox, you can do residential, you can do, PHP, IOP, and, pay for sober living, which doesn't even have to be that expensive, to tell you the truth. And you can get your clinical needs met through your insurance for a year. But you were alluding to, let's say the family has a limited amount of money. Let's say they got $30,000 and they know they can send them to another 28-day rehab for $30,000, but they've been 5 times. So you're saying, don't do that. Take them put them in, detox them, put them in sober living for a year at least. They know where they are. They know they're safe. They know they're being, drug tested, and go to meetings, go to AA, get a new group of friends with that $30,000.
$30,000 it's a vast amount of money for most people today, right? I can't tell you how many conversations I've had with moms who want to talk about selling their cars, second mortgaging their house because they love their kids, right? And this is a house they live in with their husband, who they were married to before there ever were kids, and they have everything invested in all of this, but they're willing to cut off their fingers or sell their blood, right, to raise capital for the next investment in treatment. And at some point, that's not good for anybody, right? So when those parents call and they're those traits, I'm like, under no circumstances can I tell you it's okay to do those things. Like, little Bryce has got to go to the Salvation Army, and, they're going to feed him there and give him a suit of clothes, and he's going to sing in the band, and it's going to be awesome. And he can get sober there. And that may not be what they want to hear, but if they're calling me, it's my job to talk truth to power, right? I'm accountable to give them the honest answer. Right? I don't work for a treatment center. I don't shill and fill beds, right? We don't do kickbacks. As Craig Lesor said, we're doing integrity for the long game. And for folks that do have the money and they're thinking, well, we do have the money, then I think we really should do it because, little Bryce, we don't want him to go to the Salvation Army. He wasn't raised that way and that kind of nonsense. all the more reason that you should absolutely do that. And then you should pay for the sober living for a year up front. And then you should take whatever's left of the $30,000 and you should go on a cruise around the world and turn off your cell phone, right? Bryce is a big boy. He can figure it out for a year.
I hear you.
It's about, enmeshment, families, we love each other, right? In our culture, in this civilization, there is a lot of love. Unfortunately, when it comes to treating this illness, it's not always the best tool.
Right. And parents aren't supposed to know how to treat addiction. They're supposed to be parents, right? And it's like when I started doing this, I require people to stay for 90 days. Don't come if you're not going to commit to 90 days. And the truth is that is only a fraction of the time that they need. And I got tired of watching people stay for 90 days, and then the day they move out, they relapse. And then the parents are calling me. And it's like, well, you just got him an apartment. You signed a year lease and you're paying his rent. Why? Like my father wouldn't have done that for me. I have another guy right now whose parents keep giving him a car. He doesn't need a car. He just doesn't need the car. We live downtown. And so I don't want to sound mean,
Yeah. No, I think being mean is, unfortunately, if you're getting cancer treatment, the doctor's not going to mess around. He's like, Bryce, this is going to be terrible. It's going to be terrible. We're going to pour your body full of poison. You're going to almost die. All the hair is going to fall out. You're going to want to die. And that's the reality, but this is how we're going to do it. And we don't do that with this disease, right? We pull a lot of punches and that's a shame. I heard this wonderful comic who was a recovery guy speaking once, probably 20 years ago. And he talked about he was a real homeless guy in the streets of New York in the 90s. That was his life for many years. And he talks about how people wanted to understand that. And he goes, let me help you understand what that's like. I have my cup out there on my sign that says, anything, to help. And every time you came by and you put $1 in my cup, you kept me on the street a day and $1 longer. He goes, that is the pure, unvarnished truth. He goes, there's nothing, that's all there is for me to tell you. I know you thought you were doing the right thing. I know you were trying to help and I looked pitiful and I had a sign, but you kept me on the street a day and $1 longer. And every time we pay for another treatment, pay for an apartment, every time we buy the next car or subsidize any of that stuff, we're keeping folks sick a day and $1 longer.
Yeah, it's the equivalent of buying your diabetic son, bacon and donuts and nothing else.
It's absolutely true. I mean, it's just it's medically unadvisable. I mean, I don't know what the right language is. If we weren't on this television show, I would use stronger language, but that's just how it goes. And when parents, if any parent is watching, I'm sure Bryce or I or anybody else that has any recovery experience would be happy to talk to them about why perhaps some of the things they're doing aren't helping, but they're hurting. And we'd be all glad to give you as much help as we can to get whoever it is that's sick and struggling the help they need as quickly as possible.
All right, we're going to come back next week. We're going to talk more about the same thing. I want people to understand that you do not have to be a pilot for that kind of success. And anybody, and I'm talking about anybody, from street level addicts to people from affluent families who really don't even want to be sober, can get help and can learn to keep their disease in remission, at least not die from drugs, today. And so I don't know how to do it. We can come back. We can give different examples. Maybe people will reach out to us and say, well, what about my son? What about my daughter? And we won't name names, but you can come up with a care plan for them. And I'm sure it'll be very similar to what you just described.
I think it will. But I mean, right, when you get down to what the actual solution is, it gets super simple, which is all the more mystifying about why we don't have it at large scale in our healthcare system today. But there's two guys talking about it, maybe some people paying attention, and maybe from a little seed, big flowers grow. So we're saying the right stuff, and I think when you get Craig LeSueur on in a couple of weeks, and he's one of the best and the brightest working in the field today, we'll ask him the same question and see what he says.
Okay, so the takeaway, if you take away nothing else, the goal is to get the loved one, your loved one, or yourself to a year.
Yeah. 1
year.
Yep.
Keep that in your head. You want to get to a year, and however you achieve that, that's the goal, is 1 year of substance-free life.
That's right, right? You're good to see you. I'm going to drop you off at treatment. Give me a call in 365 days, and I'll pick up the phone, and I love you, right? I really do.
Tough love. I love it. Tough love, man. All right. We'll be back next week. Thanks.
Thanks, Bryce.